Hi, welcome. So, in today's episode, I'll be walking you through some very three important points which will help you to get pregnant or get your first child. I know you might have been trying for so many months, so many years, and nothing seemed to be working. And so, today, I will be able to break through certain protocols and then get you the required information that you need. This is a very sensitive topic, and so I want to commit you and I into the blood of Jesus. So, Father Lord, I commit this episode, this topic, and anyone out there who has been trying to um, make a baby or get pregnant into your hands. We are doctors. What we do is we try to heal, but you heal and we take the benefit. Speak into every womb, speak and touch everyone who needs a baby today. In Jesus' Lord's name, I pray. Amen. I know you shouted amen. Now, I need you to take a pen and paper because by the end of this discussion, I would want you and your husband or your partner to come back in 3 to 6 months telling me or typing something in the comment section that, ooh, we made it and all glory will be to God. No, so this is what we are going to do. I'll be telling you everything you need to know, what you don't have to do, and then you will be at the receiving end. Is that okay? If you watch it alone, you are just trying to tell me that you are the only person who is infertile. But it's not about being fertile or not fertile. I need you and your partner to watch this and then come back later to tell us or give us the results of whatever happens. Now, let's go straight into it. So we define infertility, or if you go to WHO websites and trying to know why you are infertile and etc. Infertility is actually not being able to get or conceive, not being able to get pregnant or conceive after 1 year trying with the same partner, trying over a year. You need to be doing it, or you need to be trying for about 3 times in a week. And sometimes I know it gets devastating, it gets troubling, it gets a whole lot of things that you don't feel. There is anxiety at home, there is depression, sometimes even sets in. Now, if the cause of this condition or the cause after you have seen the doctor, they've told you, oh, it's not PCOS, it's not endometriosis, it's not fibroids, it's not this, it's not that, it's not like your hormones are not working. Everything seems to be intact. And I know by the time you are watching this, you might have seen a gynecologist, you might have seen your GP or physician, and they have taken you through series of tests. And yet still, they told you everything is normal. And so take your time, it's going to work out. Sit beside me. I'll walk you through. So when you've been told all these things are normal, you tend to think through everything to know why this is actually happening to you. Yes, sometimes it does because some environmental factors seem to take away the actual things that we need in our lives or in our bodies to make us who we are. And these are some of the things I'll be walking you through. So now, the first thing you need to do as partners, so I'll be stating some of the points as partners and some of them as an individual. So whilst writing your notes, make sure you take note of these things. I will state them clear. Now, as partners, if any of the partners drink alcohol, if any of the partners drink alcohol, this is the time you need to stop. Yes, you need to stop. Now, the chemical alcohol has several effects on different forms or different parts of the body, including especially our hormones. And so, if any of these partners are severely on alcohol, let's say you even take it socially, this is a journey we want to take. Okay, and so in this journey, I want you to stay away from alcohol. There are people who drink, there are people who do different things and still get pregnant. So this is a different side of the coin we are talking about. If you've done everything and you've been told that everything is normal and still you are not getting pregnant, you are the one I'm talking about. So yes, stay away from alcohol over this period of time because we don't need anything interfering with the process. Right. Number two, stay away from smoke. If any of the partners smokes cigarette or whichever form of Inhalation, I'm not talking about being asthmatic or being COPD or any of those conditions, but smoking, vaping, smoking. Please, if you are that person trying to get pregnant over the next period of 3 months, 6 months, I want you to hold on or stop smoking for this period of time, because don't forget, we have a calendar, we are looking on it. I'm giving ourselves, or we are giving ourselves 3 to 6 months. And so if you can stop smoking, if you need support, you need to go to your physicians, your GPs, and there are support systems for that. So stop drinking alcohol, stop smoking. The third one is you need to stop taking caffeine. You need to stop taking caffeine. Hold on these three things for now, and by the time the 3 to 6 months is up, we should be getting some good results. Is that okay? I'll be making a next video which talks about some of the foods you need to take in order to get pregnant the first time. Good. So moving on. Now, you need to increase exercise. So with exercise, it's not about doing extensive hours of exercise or doing more exercise. In this form of exercise, we are just trying to push blood to specific areas of the body, and that includes the male and female reproductive areas. Is that okay? Now, if you increase blood flow to these areas, it helps and foster the activity of these areas to, the blood contains all the nutrients we need. So it pushes blood there, and then it enriches these areas. Clear? I know you are taking notes. I know you are taking notes. Okay. So the next thing, let's get to some medications. There are two medications I'll mention when I'm done, because I need to explain further and make you understand. And they are the two most important medications I want you to add to these few medications I'll mention. Now, the first medication is Wellman. 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 So you need to take Wellman as the meal to boost your immune system. I'm talking about the man now. So you can write man or your partner's name, and then yourself, your name on one side. So the man, you need to take Wellman, and so is the woman. You need to take Well Woman. Now, these two medications, for both of you, you are supposed to take it over a period of 3 to 6 months. Now, taking this medication will increase your immune system, direct certain nutrients specifically towards the uterus, the ovaries, that is for the woman, and also with the man, it increases the blood supply, increases um, the nutrient to the private part, which we need, the scrotum, the testes, where we need to keep the um, the sperm very fertile. So, well man and well woman. Now, the next point is we need vitamin D3. Now, for both parties, you need to take vitamin D3. Vitamin D3, we know where the vitamin D is coming from, the sunlight, but the conversion rate is what we need in our system. In case there is a liver problem, there's a kidney problem, the vitamin D3 is unable to actually get the required amount, the quantity. If you need the quantity and etc., just keep it down here, and I'm going to um, tell you what you need to know about the vitamin D3, the volume you need. Okay, because people tend to buy vitamin D3 just any volume, and they think that is actually what is helping. Or, I mean, you need to get specific strength. Okay, so you can keep it down here in the comment section, and I will answer you. Now, moving from that, the woman, you need to start taking folic acid, and I'll tell you why. Folic acid is one thing that prevents what we call neural tubal defect. Now, the neural tube is actually the formation of the baby's brain. Now, in the absence of the neural tube, if you look on a scan for the first few weeks, you would realize that it is the brain that forms first. Is that okay? The brain begins to form, and when you see the shape, when it goes like that, it's the brain forming, and then there are demarcations, the diencephalon, and etc. You don't need to know all these things, they are medical terms. So the formation, okay, and then we tend to see the makeup of the baby. So folic acid is very, very important when you are trying to have a baby. Now, these medications, you need to take them, or the effectiveness of these medications actually starts from 3 to 6 months. And sometimes we tend to want the result much more faster than we want. And so For folic acid, whilst you are trying, you need to get the 5 milligram or 500 micrograms, not the 400 or the 4 milligram. Great. Okay, so going on, the two other medications is necessary for both the man and the woman. Is that okay? So I'll tell you afterwards. Now, let's see. With the man, let's boost your immune system together. Now, you need ashwagandha. The man, you need ashwagandha, irrespective of being told that your immune system is good and your sperm count is okay. And please go on ashwagandha for this period of time whilst your partner is also taking these medications. Is that okay? Take ashwagandha. It will boost the the nutrients in the sperm. It will help you a lot. Now, number two is you need to take fenugreek. Fenugreek. You can check online for these things. Okay, if you want to get to me, you can get to me, and then we can talk about them. Now, fenugreek. You need to get fenugreek and boost your immune system. Okay, the fenugreek also boosts the quantity of the sperm and also increases the motility of the sperm. I'm dealing with the man. Fenugreek. Also, you need to take maca roots. I usually want to say boca, maca, boca, maca, boca, maca. Right. So take maca roots. Now, this is the reason. Haven't you been told several times that because sometimes you don't know when you are ovulating, you need to have the intercourse with your partner almost every day? No, you don't need to. Because in a man requires about 72 hours to make sure the sperm he's producing actually contains all the required nutrients in his, sperm. Or else you will be getting sperm which contains fluid, seminal fluid, and things that not enriched. Okay, let's say you have sex, you have an intercourse today, you come, you release, and then the sperm goes out. Tomorrow you do say it goes out. Now the production time, there will be sperm in the testicles waiting to be produced or waiting to be secreted, but it contains no semen, and the semen is what we need because you have produced but nothing to actually push it through. And so you need this marker root to make sure you have the libido. The libido is there, your sex drive is also there, and the recommendation is that you can have sex on any other day, which means you don't need to do it every day. You can do it today, tomorrow you leave out, the next day. It can be very frustrating. The women know about this. It can be very, very frustrating. They keep on trying and it's not working. Of course, when you ask me to, or when we get into bed, I wouldn't have the the required mental state, the drive to actually do this. So with a man, you need maca root to help you and ashwagandha to help you with this. Now, with all these being said, someone is asking, what about the woman? What do you need to do? What do you need to do? Now, with a woman, your sex drive is always mentally driven. Okay, sorry, it's always mentally driven. Okay, so now that we have improved the quality of your sperm, okay, let's do this together. Now, if you have any boxer shorts, discard your boxer shorts. Now, the reason is we want to do away with anything that compresses or prevents the scrotum from hanging on free down there. And so you need to do away with your boxer shorts. Now, you have 3 to 6 months of not wearing any boxer shorts, any panty. I'm talking about the man. Any boxer shorts or supporter or whichever, you need to put them aside, either dispose them or keep them in one locker. After the woman gets pregnant, you can go back to wearing them. And so you don't need them over this period of time. Okay, going on, if you are someone who likes to work with a laptop on your thighs, on your laps, please, you are killing the sperms as the time goes on. Now, the sperm is outside or it's outside. Let me say the sperm is in the scrotum outside the body. Okay, because we need a specific temperature for the sperm to be fertile in. And so that is why it's outside like this. So if you are using the laptop or any activity that tends to put heat or increases the heat levels around your pelvic area, you need to stop it. You need to put it aside. You don't need to keep on working on it. Grab a table, grab something else, and then put your working device on in order to protect or keep a normal temperature down there. Now, talking about temperatures, for the woman, you need to regularly check your body temperature. You need to regularly check your body temperature because you know when it comes to even ovulation, you need to know how your body temperature rises during this time of the month. Okay, the mid time of the month where you need to know, okay, I feel the temperature has changed, and so I need to get an ovulation kit. I need to have an intercourse with my partner. Now, over this 3 to 6 month period, let's save some money. Do not buy ovulation kits. Hold on. You are going to be on the medications we have talked about, and the last two I'll be mentioning soon. And then, whilst taking the medications, you will be trying. You don't even need to be trying through this period. Okay, you don't need to be trying through this period because we need the sperm to be that fertile. We need the ovaries, that's the egg that you release, okay, to also be that fertile. So over this period, you can just you can have your fun, but it shouldn't be constant, as in when you are trying. Once in a while, you may want to test and see over this period of time. But otherwise, keep it going. Start taking your medications from now. And in 3 months to 6 months, we need the best outcome. Now let's see the last one. The best for the last. Exactly. Okay, so at this point, the two medications I need you to know is one, COQ10 or COQ10, and DHA. DHA. Now, COQ110, these two medications, let's talk about COQ10. That is COQ10. All right, I'll write it. So, COQ10. Now, this medication, this is what it does. Is for both the man and the woman. Aside the four medications I mentioned earlier, being the well man, well woman, the folic acid and vitamin D3, and then when it comes to the man, we add on the fenugreek, the ashwagandha, and the maca. The fenugreek can be taken throughout this period. Now, these two medications are the game changers. We don't put it out there like that. They are the game changers. Now, when it comes to COQ10, a lot of research has gone into it. Its purpose is actually not for fertility, just not just fertility, but there are several other reasons. You can check online by yourself, and then you can come back to tell me if it's good or not. But I'm recommending it. Now, COQ10, what it does is it increases or it improves on the quality of the sperm and increases the quality of the egg as well, which means that both the man and the woman needs to be on this medication over 3 to 6 months. Are you getting the drill? The DHA also increases egg quality and sperm quality, and these two medications, you can find them a lot. They are in the shops and etc. If you want us to also get you something, you can also put it in the comment section and we can get there. Now, these two, the DHA, can actually be found in omega 3. In other words, you need to take omega 3. So, if you are taking omega 3, you don't need to take DHA. But if you are taking just DHA, you can go on. If you can't find DHA, you can see DHA in, or you can get DHA in omega 3. I'm so passionate about this because I have prescribed it for some people and it's worked out. And that is why I'm coming to tell you. If you want to join my um, fertility clinic, you can also drop it in the comment section. I'll put my contacts down there and then you can join and we can take you from there till the delivery process. We are here to be of assistance to you. And I hope you have gathered all the information. If you want me to go through again, I'm saying that the man and woman, you need to be on um, well man, well woman. You need to be on folic acid as the woman. Vitamin D3 is for both of you. Then we come to the man. You need ashwagandha, you need maca root, you need fenugreek as well. And whilst doing all these things, do not have sex every day. It doesn't work like that. You cannot. Is that okay? Now, if you need someone to also speak to, we can be of help to you when it comes to that. Now, Towards the end, I want you to understand that everything you are trying and you are doing in order to get the first precious baby, it is possible. Thank you.